This is the actual retractor that we use.
Even though she recently retired from a career in nursing, Carolyn Knight is learning about the latest techniques in spinal surgery. She's paying extra close attention to neurosurgeon Shaad Bidiwala because she's hearing about her spine surgery.
For about 14 months, I had been unable to walk very far, maybe 30 or 40 feet at the most, without having to sit down somewhere.
Because Miss Knight had lumbar instability and she had such excruciating back pain and leg pain that had not responded to operations, epidural steroid injections, or physical therapy, we recommended a fusion operation. Now, anytime you recommend a fusion operation to a patient, appropriately they take a few steps backward.
But after close consultation with Ms. Knight, Dr. Bidiwala, who also has a background in electrical engineering, decided a spinal fusion was appropriate.
With his mechanical background, coupled with the surgery, that he would be able to help me better than anybody else.
A lumbar fusion operation typically involves removing a disc between two vertebrae and inserting what's called a cage, or basically a high-tech cinder block filled with bone, in between those bones. The purpose of a cage is not only to separate the lumbar vertebrae and to allow more space for the nerve roots, but it's also to provide a substrate through which fusion can occur from one vertebra to the other.
But instead of entering through her belly or her back, Dr. Bidiwala is able to enter through her side.
Using a long retractor and some nerve monitoring techniques, we are able to actually remove the disc and replace it with a cage without retracting a single nerve root or retracting the intestines. This technique was developed a few years ago, and it's enjoyed tremendous success in getting patients back to their lives sooner. Using the latest technology takes commitment, and it takes an investment. I spent a lot of time traveling and learning these new technologies, and I think ultimately it's the right thing to do because my patients benefit from it.
After this surgery, it's given me back my independence, and I mean, I can go to an in or an outlying type mall now and not have to park near a basket so that I can use it for a walker to go in. So it's just been amazing. I don't miss the pain.